all right. Ladies and gentlemen, this is the time when we get to talk about health. You see, we have gotten to that period in the year where people are always running up and down. They are going to the market to get things for the Christmas. And you have friends and family come around. Your children are going to be with you. You have friends coming all the way from the village. That uncle is coming down. You are paying rent. And sometimes this whole thing leads to hypertension if you're not careful. But guess what? We have the doctor. I like to call you the doctor. We have the doctor in the studio with us. Dr. Samuel Adegbile will share practical tips on the most common health challenges during the holidays. Essential hypertension in illness. Now, the first question I really want to find out here or ask is, what is the difference between, hypertension and then essential? Well, why is there essential in front of hypertension?
All right. So essential hypertension, the other name for it is also primary hypertension.
Okay, primary.
Hypertension,
Okay.
yes. It's one of the two types of hypertension. And it's called essential because it is when there is abnormally elevated blood pressure without any underlying medical condition. Like the other type of hypertension, which is the secondary hypertension.
There's primary, there's secondary.
There's secondary.
Okay.
Yeah. So the secondary hypertension is also abnormally elevated blood pressure as a result of an underlying medical condition. Yeah, so that's what differentiates. And essential hypertension actually accounts for about 90 to 95% of the amount of hypertensions that we have in the world.
Okay, so what causes high blood pressure? And why is it called the silent killer?
Yes,
Why
yes.
is it called that?
Yes. So there is no direct cause to hypertension, literally, just like what most people say, oh, you're thinking too much, maybe that's why you're having hypertension, or some will tell you maybe because they don't sleep well, or one thing or the other. There is no direct cause for hypertension. However, there are risk factors that leads to hypertension, such as the commonest risk factor is the family history, family history of hypertension. We also have obesity. There is also the unhealthy diet, in which that's why we're talking about it in this festive period. People are prone to eating a lot of things in this festive period. Yes, they're taking of alcohol in high consumption of alcohol,
Wow.
smoking, sedentary lifestyle,
Okay.
and the likes.
Okay, so I noticed that when you started, you were trying to debunk some rumors, like how you sleep and all that. Are there some things that do you want to debunk more of those rumors?
Yes,
on
yes,
high
yeah.
blood pressure?
Why am I saying this? Because you see some people come to the hospital, and when they check their blood pressure, it's elevated. Then they try to tell you why it is elevated. They'll tell, oh, doctor, I didn't sleep well yesterday. That is why my blood pressure is elevated. Or I have not, I've been busy. I've been
Yes.
stressed out. Or I lost a relative. That is why my blood pressure is high. So we try to tell them that there is no direct cause to hypertension.
What about shock?
Yes, shock.
Shock
Yes,
sometimes.
yes, shock. It's not a direct cause to hypertension.
Okay.
Yes, it can. Though sometimes shock can give a transient increase to your blood pressure, but after the person relaxes, it comes down. Yeah, because that's why the definition for hypertension itself is when there is persistently elevated blood pressure above 140/90.
Okay.
Yeah, so persistently elevated blood pressure. So when you have a blood pressure of 150/90 today, and you rest, you check tomorrow, you're having 120/80, that person is not hypertensive. It's not hypertensive. But hypertension is when there is persistently elevated blood pressure.
So you also talked about the fact that this period is where people get to eat a lot, drink a lot, do a lot. So what are the roles, or how does food play in all of this? Are there certain things I shouldn't eat this period? Are there certain drinks I shouldn't take? I know you were saying a little, but can you just tell us, because I plan to eat a lot.
Yes,
period.
please go ahead, eat a lot, but eat rightly. That's the major
Please
thing.
define that.
Yes, eat rightly. So food that can actually predispose one to or put people at risk of hypertension include food that contain high salt diets.
Salty food.
Yes, you try to avoid that.
Avoid salty food. Avoid salty food.
Yeah. So high consumption of alcohol. Yes. Smoking is a no-no. If you want, because WHO
Can you
recommendation.
please say it again? Can you please say it again? Smoking
is
is
a
a no-no.
no-no.
All right, go ahead.
Yeah, because WHO actually recommends quitting smoking when we are trying to manage hypertension, but alcohol should be minimal. You should avoid high consumption of alcohol. Yes, and also food that are rich in saturated fats, like red meat, beef. You know, you want to take less of that, or you stop it as much as you can. Yes, you don't want to
Beef.
take beef, red meat. You don't take too much of
Doctor,
of red meat.
doctor. I don't know about beef. I don't know.
Oh,
I'm having beef with you now.
no, no, no.
All right, go
All
ahead.
right, yes. So those are foods
Okay.
you want to try to
Avoid.
avoid. Yes, or take as minimal quantity. Yes, for during this festive period.
All right. So what are the early signs that one can really just look out for? That, you know, before you start going to the doctor, what there's things you would notice in your body to say, it's like I'm already having high blood pressure, or this is
Okay.
already coming up small. Are there things we can actually just
Oh,
notice? Or,
okay, yeah. That question, what you just asked now answers your first question.
Okay.
I've talked about the why is it called a silent killer. It's called a silent killer, which also answers this your recent question because it is asymptomatic. Means that it doesn't give symptoms. Yes, the early signs there is no symptoms to hypertension
so you can have hypertension, you know of one.
without any symptoms.
Wow.
For years. So that
For
is
years?
yes, that is why it's called a silent killer. The major way to know you are hypertensive is by checking your blood pressure, majorly in the early times. So when people start having complications, when people start having symptoms, it means complications are beginning to set in, such as some complain of chest pain, some will complain of palpitation, leg swelling, some will say they are dizzy.
What about back pain? Back pain.
Back pain?
Is
No,
there anything
no,
with
no,
back
no,
pain?
no, no, not
Okay,
really.
I'm safe. I'm safe.
All right.
All right. Thank you so much. For those of you who are
welcome.
home, this is very important that you take your health seriously. Make sure you go check yourself. You never can tell. Please do not go anywhere. We'll be right back after the short break.